Ayan, magandang umaga po. Welcome po sa ating media partners, listeners, at saka viewers na live na po tayo ngayon. Welcome po sa ating Kapihan session this Thursday, March 24, 2022. Now, ang ating topic for today ay updates on Sinovac for the pediatric population. Now, we have guests po here, very prominent guests and experts po, formerly from the vaccine expert panel and also from the Pediatric Infectious Fellow of the Philippines Pediatric Society. So let me introduce you to them to formally start our program. Now, first we have Dr. Nina Gloriani, who is formerly from the Vaccine Expert Panel Technical Working Group for COVID-19 Vaccines and Development. Doc Nina is with Dr. Liza Antoinette M. Gonzalez from the Pediatric Infectious Disease. She is a pediatric infectious disease specialist and a fellow of the Philippine Pediatric Society. Now, they will be presenting our slides regarding updates on Sinovac for the pediatric population. Now, to formally start, tawagin po natin si Doc Chet or Doc Liza Gonzalez. Please present her slides. Sir Ray, may we have the slides na rin po. Magandang umaga po.
Hello, magandang umaga po sa lahat. So, ito po, magsa-start na po tayo. Ang topic po natin today is about the use of or updates on the Sinovac vaccine, no? For pediatric age group. Who is operate yan? Okay. Can we have the first slide? Okay, so we know that individuals of all ages are susceptible to SARS-CoV-2 infection, and with the widespread vaccination coverage of adults 18 years of age and older, of course, we expect now that children and adolescents will represent a growing proportion of new COVID-19 cases. So based on the latest DOH statistics, children 0 to 9 and adolescents 10 to 19 account for 12% of the total number of cases. Although children generally present with fewer and milder clinical manifestations compared to adults, COVID-19 in children can result in severe disease, can result in hospitalizations, deaths, and other short and long-term complications. And there are studies that show that the SARS-CoV-2 infection can lead to a serious complication known as the multi-system inflammatory syndrome in children, or MIS-C, which includes myocardial dysfunction that can lead to heart failure, shock, and respiratory failure that will require intensive care. Children of all ages can also spread the virus to others. So children can serve as an important reservoir of SARS-CoV-2 transmission both in the household and community, and may play a role in prolonging the pandemic. Now, vaccination is the most effective way to prevent COVID-19, and it will offer an additional layer of protection against severe disease, hospitalization, and deaths to all, so including children, no? And evidence to support the efficacy, immunogenicity, and safety of the two mRNA vaccines, namely the Pfizer and the Moderna mRNA vaccines, came from large randomized controlled clinical trials that show that both vaccines are highly efficacious in preventing symptomatic COVID-19 in adolescents more than 12 years of age. And in addition, the Pfizer vaccine also, which contains a smaller dose, 10 micrograms than the recommended dose for persons more than 12 years, which is 30 micrograms, has also been shown to be effective and safe in children 5 to 11 years. Now, studies in Moderna vaccine for children below 12 are still ongoing, but preliminary unpublished data have shown that the COVID-19 vaccine for children ages 6 to 11 using the Moderna vaccine is safe and produces a strong immune response. So we are still waiting for the published report. Now, there are other COVID-19 vaccines being evaluated in children and adolescents. And one such vaccine is the inactivated Sinovac COVID-19 vaccine, for children 3 to 17 years old. This vaccine has been approved for use in children below 18 years in China and is now being deployed in countries such as Chile, Indonesia, Ecuador, Malaysia, and Cambodia. In the Philippines, the FDA announced the EUA of the Sinovac pediatric vaccines just recently, so last March 14, 2022. So this Kapihan will present data from 3 Sinovac pediatric vaccine studies. Next slide. So this first study was conducted by a group of Chinese authors who reported on the safety, tolerability, and immunogenicity of an inactivated COVID-19 vaccine, so CoronaVac or Sinovac, in healthy children and adolescents aged 3 to 17 years. So this was a randomized, double-blind, controlled phase 1 and phase 2 trial. Next slide. So the study was conducted by the Hebei Centers for Disease Control in Zhanhuang, Hebei, China. So between October and December 2020, 72 participants were randomly assigned to the vaccine or control group in phase 1 and 480 in phase 2. So a total of 550 in both phase 1 and 2 were included in the safety analysis. So 71 in phase 1, 479 in phase 2. Children were categorized by age into 3 groups, 3 to 5 years, 6 to 12, and 13 to 17. They received 2 doses administered 4 weeks apart of either the low dose, which is 1.5 micrograms, or the high dose, 3 micrograms of vaccine, or the control, which is an alum or aluminum hydroxide. So the phase 1 trial was an age de-escalation from older to younger and a dose escalation study from low to high dose. The participants in each age group were recruited in order from the low dose stage to the high dose stage. Phase 2 trial was initiated only after all the participants in phase 1 had finished and passed the 7-day safety observation period after the first dose, as confirmed by the Data Monitoring Committee. So in phase 2, aside from determining safety, immunogenicity of the 2 doses in children 3 to 17 years old, it also determined the appropriate dosage for further clinical evaluation. Okay, so the mean age of the study participants was 9.2 in phase 2 and 8.3 in phase 1. Next slide. So what were the results? The adverse reactions within 28 days after injection were evaluated in the 550 participants in the combined safety profile for phase 1 and phase 2. So in overall, 27% or 146 out of the 550 reported at least one adverse reaction within 28 days of either vaccination. And the proportion of participants with any adverse reactions were similar across the groups. In general, the adverse reactions were mild to moderate in severity, and there was no difference in the incidence of the adverse reactions in the different dosage groups. Pain at the injection site and fever were the most frequently reported reactions. Other reactions such as cough, headache, loss of appetite were reported in only 1 to 4% and were mild to moderate. Actually, this is what is similar as what is seen in adults. There was one adverse event. This was pneumonia, and this was reported in the control group or the aluminum-only group and was considered to be unrelated to the vaccination. Next slide. So this table, excuse me. This table summarizes the results. Sorry. So this table summarizes results. Excuse me. Excuse me, hold on.
Alright, paumanhin po sa ating mga tagapakinig. Mukhang nasamid po ang ating guest
Sorry
na si
po.
Doc Che.
Sorry po. Okay.
Okay na po sila, Doc Che?
Opo.
Okay po,
Okay.
sige po.
So this
Please
table,
continue.
okay. So this table summarizes the results for seroconversion after 2 doses of the study vaccine in phase 1 and phase 2 trials. So in phase 1, the seroconversion of neutralizing antibody after the second dose was observed in all participants, so 100%, regardless of the dose, whether 1.5 or 3 micrograms. In phase 2, none of the in phase 2, the seroconversion was 100% in those who received the 3 microgram dose and 96.8% in those who received the 1.5 dose. So it was higher in the 3 microgram group. And of course, as expected, there was no detectable antibody response in the alum-only group. So in this okay, so can we go to the next slide? Okay, so the graphs on the left side or on the left panel will show the results for phase 1, and the ones on the right panel will show the results for phase 2. And separate analysis or separate graphs were done for the overall 3 to 17-year-old cohort, and then separately for the 3 age groups, so the 3 to 5, 6 to 11, and 12 to 17. In the graphs, the green dots will indicate the antibody titers after the low dose, 1.5 grams, and the blue dots after the 3 microgram dose. And then what is also indicated in the graphs are the geometric mean titer estimates, as well as the p-values comparing the difference between the pre-vaccination and after the vaccination. So in phase 1, overall, for the 3 to 17 years, the geometric mean titer of the neutralizing antibodies were 2.2 times higher in those who received the 3 microgram dose. So it was 117.4 versus 55 in the 1.5 years age group. And for the phase 2, it was actually 1.6 times higher in those who received the 3 microgram dose compared to the 1.5 microgram dose. Okay, so this trend was also seen in the different age groups. So in the 3 to 5 year age group, in phase 1, it was actually 3 times higher. The GMT was 3 times higher in those who were given the 3 micrograms compared to the 1.5 micrograms. Next slide. So this trend for significantly higher neutralizing antibody titers in those who were given the 3 microgram dose is seen for the other age groups, the 6 to 11 and 12 to 17 year age group. And this is also indicated by your p-values, except for the 12 to 17 year age group, where the difference between the 3 microgram group and the 1.5 microgram group was not significantly different, but it could be explained or attributed to the smaller sample size in phase 1 among the 12 to 17 compared to phase 2. So we can therefore conclude from all these results that the 3 microgram dose of Sinovac induced higher immune responses in all age groups compared to the 1.5 microgram dose. Next slide. So in conclusion for this study, this is the first published report of an inactivated COVID-19 vaccine tested in children and adolescents 3 to 17 years of age. Sinovac or CoronaVac was found to be well tolerated and safe in this population. So the seroconversion rates of neutralizing antibody were over 96% after 2 doses, with a range of 93 to 100% in the different age groups. The neutralizing antibody titers induced by the 3 microgram dose were higher than those of the 1.5 microgram dose in all age groups, so 3 to 5, 6 to 11, and 12 to 17. So taken together, the 3 microgram dose of the CoronaVac induced higher immune response in all age groups and support the use of the 3 microgram dose with 2 dose immunization schedule for further studies in children and adolescents. So with that, I'd like to end the presentation of the results of the first study and turn over the floor to Dr. Nina Gloriani, who will now present the second study. So, Ma'am Nina, the floor is yours.
Yes, thank you very much, Dr. Chet, and good morning sa inyong lahat. Okay, after that phase 1 and phase 2, those results for Sinovac children 3 to 17 years old, we move now to a vaccine effectiveness study. So, hindi to efficacy, kundi vaccine effectiveness, meaning real world conditions or real world data that we will show here. This is from Chile, 2021. So they have this report, actually preliminary, some of this effectiveness of an inactivated SARS-CoV-2 vaccine in children and adolescents, a large-scale observational study. So it is still a preprint, but the cohort that was included is 6 to 17 years old. So dito, may tanong kasi kanina, ba't hindi kasama yung 3 to 5? Kasi doon sa effectiveness study, ito yung real world, only the 6 to 17 years old had data. So with you either vaccinated with CoronaVac or Pfizer vaccine. So mayroon silang comparison sa Chile. And then this is about 2 million children, 80% of whom were Chilean children. Next slide, please. So, as usual, we present first the safety data, and as always, halos naman lahat itong vaccines that we have deployed or we are continuing to use have very good safety profile. So, makikita ninyo, so yung sa local side effects, usually pain pa rin, and then sa systemic side effects, mayroong fever, fatigue, headache, pero konti lang yan. So, for the safety of this vaccines in children, generally safe, mostly mild, and transient in this age group. 3 to 17 itong safety, Okay. Next slide, please. So now we move to the seropositivity and seroconversion. You must understand na pag ganitong mga immunogenicity studies, only a few volunteers are actually tested kasi may blood extraction. So merong 12 volunteers, So 12 volunteers, this is 12 to 17 years old, pero what you see here is all of them became seropositive after 2 doses of the CoronaVac, and the seroconversion, pag sinabi natin nag-seroconvert, mayroong 4-fold increase in titer over the baseline. So 100% pareho yan. Seropositivity, positive, and nag-seroconvert by more than 4-fold increase in titer. Nung antibodies against the receptor binding domain neutralizing antibodies 4 weeks after the second dose. So next slide, please. So yan yung seroconversion. Now, in this particular study, actually, bihira ito na nagbibigay ng data on saliva antibodies na tines. But actually, we asked Sinovac ba't nila ginawa ito. They were actually trying na baka it will be easier to collect saliva samples than blood, So, But so they showed this, kahit konti lang na children ito, this about I think 8 children. Teka, nasaan yung saliva? Meron pang isa, nawala yung isa. Before, please. Ito. Dito muna tayo sa saliva. So, 8 children tong merong data, no? So, you have, their saliva was tested for antibodies, IgG antibodies against the spike, RBD, of SARS-CoV-2, 28 days after the first dose, and 42 days after the first dose or 14 days after the second dose. So, makikita nyo doon sa left panel, so these are 8 children, medyo merong matataas na bata, no? Makita nyo yung absorbance, that means yung titer, yung dami nung antibodies doon sa saliva, pero hindi ganong mataas pa. But if you look at the right panel, yung B, 42 days after the first dose or 14 days after the second dose, tumaas na ito. So, siguro meron tayong 1 in 200, maganda yung pagtaas. So, remember, this is saliva, no? Medyo mahirap gawin yan, pero mas madaling mag-collect. Okay, pero relatively mababa yung titer pag saliva, no? So, but we are happy with these results. Nakita natin na talagang nag-increase naman after the second dose. So, we move to the next slide, please. So, ito naman yung sa serum. So, antibodies ito. They looked at the antibody titer, reciprocal titer, again, of neutralizing antibodies against spike RBD ng SARS-CoV-2. So, makita nyo, yung titer, reciprocal ito, nyari yung from pre-immune to yung titer. Nung 4 weeks after the second dose, yung titer naging 64. So, medyo iba to ha, yung do sa kabila, do sa B. So, pero tumaas din, ibig sabihin, 2 times 2, 4 fold, actually at least 32-fold ang increase nitong antibodies na to, na nasa blood na ito, neutralizing antibodies, 4 weeks after the second dose. Now, these antibodies, yung level ng antibodies, ay transform nila into the World Health Organization standardized international units. Kasi ngayon, dapat ito na yung ating kino-compare. Binabasehan na okay ba ang titer, ang antibodies na na-produce or hindi. So what you see here is do sa pre-immune, ang kanyang international units ay 16.4. 4 weeks after the second dose, naging 422. So mataas na yan, no? Kasi actually itong international units na to, hindi pa rin naman sila clear ano yung may protective level, pero naglalaro yan sa 100, 200, 300, and if you're looking at 400, you can say na that is protective enough. So yan, no? So yung day 2, yung reciprocal titer from 2 to 64, and then yung neutralizing antibodies na transformed into international units from 16.4 to 422. So, nag-increase. Next slide, please. Okay, so just a summary of the immunogenicity data. So, we saw a low level of anti-S1 RBD IgG in the saliva samples of 8 volunteers obtained at the time of the second dose, pero this was increased 42 days after the first dose or 28 days after the second dose with the Coronavac vaccine. And these results suggest that a high level of IgG is detectable in saliva after the second dose, which was verified later with serum samples from the same volunteers. So yun yung pinakita ko, no? So an increase in neutralizing antibodies at 56 days post first dose was observed in 100% of the 12 subjects tested. Ito yung zero conversion that we showed earlier, no? So that was 100% after the second dose. So, next slide, please. So, ito na yung importante, yung vaccine effectiveness data na malaking naging basehan namin dito. Kasi ito real world conditions, no? Yung sabi ko nga na about 2 million, 6 to 17 years old na children ito. Vaccinated with Sinovac and also with Pfizer. So, ano yung vaccine effectiveness? Hindi ko na pinakita yung computation, but the VE, vaccine effectiveness, 14 days after the second dose against COVID disease was 74.12% for Sinovac, 84.94% for Pfizer. So, clearly you can see Pfizer has higher VE against symptomatic COVID-19 disease. Pero if you look at the protection against hospitalization, ICU admission, and death, nagkakapareho na sila. Even mas mataas pa ngayon yung Sinovac for ICU admission protection than Pfizer. So yung against hospitalization, Sinovac 90.24, Pfizer 92.23, against ICU admission 100% for Sinovac, for Pfizer 87.65, and against death 100% for both. So overall, these results suggest that primary immunization regimens with Pfizer and Coronavac provide a high level of protection against COVID-19, higher against severe disease, hospitalization, ICU admission, and death among children 6 to 16 years old. So next slide please. So dito na, dyan later papasok yung question, may question sa variance, and Dr. Chet will present to you the third article. Ikaw na, Dr. Chet.
Thank you, Ma'am Nina. So thank you for presenting the effectiveness study. So real world, no? Real world yon. Kasi alam naman natin when we evaluate the protective protective efficacy of a vaccine, we always need to consider both, no, clinical trials and real world data. Okay, so this third study assessed the safety and immune response, both antibody and cell mediated, no, cell humoral and cellular immunity against virus variants in healthy children and adolescents in Chile. So this was also a randomized double-blind placebo-controlled phase 3 clinical trial, and it included children 3 to 17 years old who were inoculated with 2 doses of the 3 microgram Coronavac in a 4-week interval, so 0 to 28 schedule. So with regards to the safety data, we always start with the safety data. All 963 children were assessed for safety, and the primary adverse reactions reported after the first and second dose was pain at the injection site. So this is usually the usual local reaction that we see, no? And the adverse events reported were mostly mild and local. So local meaning at the site of the injection, and there were no serious adverse events that were related to the vaccine that was reported. Next slide. So the study evaluated, aside from safety, the immune response by measuring the binding and neutralizing antibody. So the graphs on the upper panel will show the anti-spike binding antibody levels, while those on the bottom will show the anti-RBD neutralizing antibody levels. So binding and the bottom is the neutralizing titers. And we see that the study vaccine induced a significant increase in both the binding and neutralizing antibody titers 4 weeks after the second dose compared to the pre-vaccination or pre-immunization levels. And if we compare the 2 age groups, meaning the 3 to 11 and the older or the adolescent age group, the 12 to 17-year age group, the binding antibody levels are similar. But when we take a look at the neutralizing antibody levels, it seems that the neutralizing antibody levels in the 3 to 11-year age group is higher compared to the 12 to 17-year-old age group. So 713.1 in the 3 to 11 versus 492.2, and this is significantly different. Now, we don't really know if this has clinical significance because in both naman the binding and neutralizing antibodies, there was a significant increase in the titers after 4 weeks after the second dose. Okay. Next slide. So the study also characterized the cellular immune response after 2 doses of the Coronavac. So the vaccine induced a robust activation and memory population of the CD4 T cells in children and adolescents, as shown by the following. The T helper 1 cytokine, interleukin 2, and the interferon gamma were increased 4 weeks after the second dose when stimulated with various peptide pools. So peptide pools from the different proteins, the spike protein, the receptor binding domain, the matrix, and the nucleocapsid of the SARS-CoV-2. Second, next slide. So to assess whether the coronavac induces immune response against the variants of concern, so they used a pseudotype virus neutralization assay to evaluate the neutralizing antibody protection against variants of concern, specifically the Delta and Omicron, as compared to the D614G, which is an earlier variant, no? And the results showed that both neutralizing antibodies and T cells recognize the Delta and Omicron variants of the SARS-CoV-2. Okay? And there was also a significant mild increase against the peptide pool of the Omicron variant, which is 1.63 times increase as compared to the wild type strain. So what does this suggest? It suggests that coronavac is likely to confer protection against infection against the SARS-CoV-2 variants in this target population. Next. So, to conclude, and what are the take-home messages? No, 2 doses of the coronavac or Sinovac given to children 3 to 17 years old was found to be safe with only mild and transient local and systemic side effects. So these pediatric vaccines showed increased both in the binding and neutralizing antibodies against the spike receptor binding domain, or spike RBD, of the SARS-CoV-2 4 weeks after the second dose. And a robust T cell activation and memory CD4 T cell populations were observed in these studies. So meaning that there is a good cellular immune response. No? So both neutralizing antibodies and T cells also recognize the Delta and Omicron variants of the SARS-CoV-2. So Sinovac administered to children 6 to 17 years old showed high vaccine effectiveness against symptomatic COVID disease and higher protection versus hospitalization, ICU admission, and deaths. So we still need to wait for the DOH guidelines for the rollout of the Sinovac pediatric vaccines, because these are still being currently developed by other expert groups, including the pediatricians. So I think that's the last slide. Thank you very much. And we will now take your questions.
Yan. Maraming salamat po, Doc Chet and Doc Nina, for presenting updates on Sinovac. Now, we move on po sa ating Q&A portion. Now, a lot of these questions po siguro nasagot din sa ating presentation. Para just to reiterate, I may ask questions that were already cleared kanina po for the benefit of those listening in Facebook and YouTube. So our first question for this morning is, why is there no difference in the formulation and dosage of Sinovac for adult and children? In comparison po ito to mRNA vaccines. We also have a similar question din po from Red regarding that. Same frame of questioning po. Why is there no difference in formulation and dosage sa ating Sinovac? Doc Nina and then Doc Lisa, maybe you could add to this.
Oh, actually, yung sinabi ni Doc Chat kanina, nag-dose de-escalation. Kasi that's how you do it. Pag-uumpisa ka sa mataas, sa mababa. But what did they find out? And Dr. Chet showed that. Mas mataas yung immune response doon sa higher dose. That is why, yan yung higher dose that is actually being given to the adults. So yun yung pinili. May basis yan for actually choosing. Kasi lower than that, wala kang protection. Dr. Chet may add some more.
Sige po. We have to remember that these are two different platforms, no? So hindi man ibig sabihin yung 3 micrograms nung Sinovac ay pareho or less than the 10 micrograms of the Pfizer. So hindi po ganun yon. So kaya nga po important yung clinical trials kasi yung phase 1, phase 2 talagang dose finding yon. So they need to really find out which is the best, which is the optimal dose that will be able to give the best immune cellular and humoral immune response, as well as safety din. Kino-consider din natin, of course, yung safety. Kaya yung mga ibang vaccine platforms nagre-reduce sila ng dose kasi meron silang nakita about the safety with the higher doses. And same dito sa ibang vaccines natin like Sinovac, wala naman silang nakitang difference with regards to safety with the lower and the higher dose. So, yun.
Alright, maraming salamat po, Doc Nina, Doc Liza. Now, our next question po is from Carolyn Bongkin. Although this question po siguro is more of on part siguro of the DOH and may remind this is still undergoing review. Pero maybe Doc Nina could provide a general update or comment regarding this question. Ang tanong niya po, what is the current recommendation and updates pagdating po sa boosters or fourth dose, a booster to the booster? Doc Nina?
As far as we know, nag-request na ang DOH nga, no? For an amendment to the EUA. So, we recommended sa FDA for the second dose for very specific populations. Ito yung moderately to severely immunocompromised, the elderly, yung mga very high exposure to possible COVID because of occupational settings, no? So we're waiting for yung magiging action ng FDA. So alam ko nasa FDA na yung kasi may process yan. Bibigay namin sa FDA yung recommendation and then malalaman niya ng DOH. The DOH will have to request for an amendment to the EUA. So hanggang wala yung amendment, hindi siya pwedeng i-deploy. So bumalik sa FDA na hindi bumalik from DOH ito. So waiting tayo and we are hoping na baka mga 2 weeks sana. Pero wag natin madaliin. Busy din sila.
Alright, maraming salamat po Doc Nina for the update. Now for the next question po, these are two related questions din. Pwede bang isabay sa ibang bakuna ang current boosters or para sa pediatric population? And related to that, may studies po ba na pwedeng i-mix and match ang ating bakuna for Sinovac boosters for pediatric? For since hindi wala pa po tayong boosters for pediatric population, pwede daw po bang i-mix and match ang bakuna?
Ay, Dr. Chet.
Sige po. Okay, so yung general rule po natin, since inactivated naman po yung Sinovac, pwede pong ibigay concomitantly or at any time interval with the other vaccines. So, hindi po natin kailangan ipagpaliban kung kailangan ng tumanggap ng routine immunization yung mga bata. So, it is perfectly fine to give the vaccines at the same time or at the same visit. So, I hope nasagot ko po yun. So, wala po. Pwede pong sabay, pwedeng the day after, 1 week after, 2 weeks after, wala pong problema. Kasi inactivated nga po siya. Ngayon po yung second question about mixing and matching. Actually, there are no studies on mixing and matching in pediatric age groups unless may nabasa po si Ma'am Nina. So I would be a bit hesitant to do mix and match in children until we have enough data siguro or studies on that. So I would suggest that if you start with one type of vaccine, that you continue with the same type for the second dose.
All right, thank you po Doc Chet for clarifying that. Now, the next question po is from Caroline Bongkin. Now, If the study presented by Dr. Gonzalez says CoronaVac is safe for age 3 and up, why did the VP only recommend it for 6 years old and up? And when or at what point will the VP recommend Sinovac for 3 to 5? We have a similar question din po from Red regarding the same statements po. Doc
Answer.
Liza and then maybe Doc Nina.
Doc Nina first.
Okay po. Doc Nina, please go ahead.
First daw muna. Hindi, we only have data for vaccine effectiveness sa 6 to 11. The one that I showed. Hindi nila na-include sa effectiveness study yung 3 to 5. Kaya yun ang naging basehan namin. Of course, they added yung safety dun sa 3 to 5. Pero yung effectiveness, 6 to 17 lang yon. That is why. Now, if they provide us data, kasi continuing naman yung kanilang ibang clinical trials phase 3, dito sa age groups na ito, if they provide sufficient data na effective din ito dito sa age group na to, that could be amended pa. Dr. Chet, baka mayroong kapagida.
Yeah, so syempre gusto nung company mag-umpisa sa 3, di ba? Pero hindi lang naman po safety yung kino-consider ng panel na nagre-review. So we take into consideration, of course, the efficacy and the immunogenicity. Tapos minsan pa, hindi kami pumapayag na phase 2 lang. Gusto sana namin talaga kung meron talagang phase 3, syempre mas maganda kung may phase 3. So we take into consideration all of that, not just safety. All of it, safety, immunogenicity, and efficacy. Thank you.
All right, thank you po Doc Nina and Doc Chet. I think we have a follow-up question din po from Red on the same topic. Meron na po bang data or nakitang data ang Sinovac sa 6 months 6 months old to 3 years old?
That I know.
Doc Nina and Doc Liza.
Wala pa po. Although may mga ongoing, I think maraming may ongoing studies, no?
Ongoing.
Yung kanilang protocol nagsa-start sa 6 months, most of them. Pero yung nilalabas muna nilang, kasi nga it's a dose, age? Ano tawag doon? The escalation. So they start with the older, going down. So yung mga sinasubmit din nila na mga data, yun dun sa mga older muna na natatapos nila. Siguro when they see that it is safe and effective, dun pa lang sila bababa. So again, hindi rin naman pwede nilang i-extrapolate na yung safety at saka yung dose na ginamit sa older, ganun din yung gagamitin. So talagang hindi siya ganun kabilis na maglabas sila ng result. So as of now, wala pa. So ang meron lang tayo immunogenicity and safety from 3 and above, pero yung effectiveness, sabi nga ni Ma'am Nina, pa lang, 6 pa lang and above. So ganun po, hintayin po natin yung results. So ngayon wala pa po.
Right, maraming salamat po Doc Chet, and I think just to add to that, based po sa ating kapihan kahapon, since wala pa pong vaccines ng ating mga below 4 years old at saka yung mga batang infants pa lang, I think there has been studies and it has been proven ng ating pong nanay ang nagbibigay din po ng immunity sa ating mga anak or infants if once they have generated their own antibody. So natatransfer din po sa ating mga anak ito. But maybe Doc Chet could add to that if she wants po. Would you like to add to that, Doc Chet?
You mean pag breastfeeding? Ganon?
Yes, breastfeeding.
Yes. So there are already studies that show that after vaccination, antibodies are actually found in the breast milk. So we assume or this implies that the protection can be the antibody levels in the breast milk can be transmitted or transferred to the infant. So another good reason to continue breastfeeding.
Okay. Maraming salamat po Doc Lisa and Doc Nina. Now, I think we're down to our last few questions po. I think this next question po is from Red Mendoza. Mayroon din po bang data ang Sinovac against VOCs? Am I correct in understanding this na it's volatile organic compounds? Tama po ba? On children. Tama ba? Sorry po.
Variants of concern.
Variants of concern, sorry. I apologize.
Opo.
So, variants of concern.
Oo, yun pa lang yung study na pinakita ko, yung third study against Omicron and Delta. So, merong mild or modest protection against these variants. So we don't really know. These are ang ginamit nila pseudovirus neutralization assay. So laboratory pa lang, hindi pa talaga natin alam how it will do in the real world. So yun siguro yung hinihintay natin, but at least we know na meron neutralizing antibodies, both neutralizing antibodies as well as T-cell responses against these two variants. So it will need further studies before we can really say that they are effective. Kasi nga laboratory lang po siya.
Alright, maraming salamat, Doc Chet. Now, I think this is the last question for this morning, and this is also the last that we can accommodate due to time constraints. Ang tanong po is, are children with a known history of comorbidities, meron po bang considerations bago sila magpaturok ng Sinovac? Or siguro vaccines and boosters in general?
Ma'am Nina, I'll go first.
Yes, it's okay.
Opo. So, I would assume that since this is an inactivated vaccine, the contraindications would be the general contraindications, no? Yung nag-allergy before, at saka yung may mga unstable, undiagnosed or progressing medical condition. So yung mga ganon, hindi natin siguro pwedeng i-vaccinate. Ano pa ba? But otherwise, I do not see any reason why, nisip ko, why or what contraindications there would be if a patient would have any comorbid. So I can't think of anything except for that. So siguro yung ano siya, yung talagang moribund na severely ill, progressive, undiagnosed, unstable condition, that would be the only condition I would think that would contraindicate to giving this particular vaccine. And of course, allergy to any of the components of the vaccine. But otherwise, I think it would be safe to give this vaccine even to those with comorbidities. Ma'am Nina?
Yes, thank you, Dr. Chet. No? Well, actually, yan naman yung premise. No? We want to vaccinate those who are at higher risk for especially severe COVID. So like to sa mga adults, although you know, generally ang clinical trials, ang participants ay generally healthy. Doon sa adults, may mga participants na talagang may comorbidities, defined yon. But for these children, yung clinical trials nila, nag-include din sila, although hindi nila in-specify masyado, kung anong mga comorbidities meron yung mga bata, but they were medically stable. Stable, otherwise good, healthy at the time of the clinical trial. So I would assume na walang issue dyan. Actually, in fact, the ones with the comorbidities will be the ones who will benefit most. Remember, do sa 12 to 17 natin years old na deployment, na inuna natin ang immunocompromised dyan. So, I would assume na ganun din. Basta medically stable and may clearance from their pediatricians.
Ayan, maraming salamat po Doc Nina and Doc Chet. I think may last na pahabol po tayong question mula kay Caroline. I think this is a general question po. Ang tinatanong niya lang po is, as per Doc Nina po, nangihingi daw ng guidance from pediatric groups regarding Sinovac for kids. Ano po ang considerations na ito na hinihingi po sa kanila?
Ang sasagot dyan, pediatrician.
Considerations, the usual naman is the data sufficient to be able to recommend this? So again, ang daming kailangan i-weigh, yung benefits versus the risks, no? And kasi alam naman natin na evolving yung data. So talagang hindi pa tapos yung mga trials. Yun yung big issue. So ang inaano nila, do we have enough to be able to recommend it? So kailangan nila i-weigh at kasi since we are in a pandemic, most of the time naman hindi pa talaga tapos lahat ng trials, hindi pa in yung mga data, but syempre hinihingi na talaga yung information kung ano ba pwede na bang ibigay o hindi. So lahat yan kino-consider, yung pati yung acceptance, aside from yung results nga ng mga preliminary studies, cost, lahat po yan, no? Yung kino-consider po lahat yan. So yun po yung pinag-aaralan nung group. Lalo na yung HTAC. Yun. So yun yung mga kino-consider nila. So not only all of that, kino-consider nila yon. So hindi ganun ka ano yon. Kasi alam naman natin di pa tapos yung mga trials. Ma'am Nina, baka may dadagdag ka po.
Hindi, yung kasi, I'm not really sure kung sinabi namin na talagang healthy. Medically stable. Kasi ganun din sa adults, no? Sino ba ang magbe-benefit more? Kasi, sinabi nyo, mild sa mga younger, and konti lang, pero may severe, may missing, may ganon. So, for as long as they're medically stable, I really do not know what guidelines the pediatricians may come up with, but I'm sure na yung mga may comorbids will have to be considered kasi sila yung mas nangangailangan. But we'll have to wait for that. I defer to the specialists for these children.
Alright.
Ma'am,
Maraming salamat po,
last
Doc.
na lang if I may
Sige.
add. Oo. Isa pang kino-consider kasi minsan hindi lang yung direct benefits ng vaccine, no? Lalo na in children kasi alam naman natin that the manifestations are milder as compared to adults. But we have to consider the indirect benefits also, which may be greater in children in terms of ano ba yung mga indirect benefits. Well, yung pagbabalik nila sa school, yung return nila to their social activities, their social life, their sports activities, lahat po yan dapat i-consider natin kasi talaga naman pong yung well-being at saka yung mental and physical and psychological health ng mga children was really affected by the pandemic. So isa pa yun na kino-consider sa pagpili nung or pag-recommend ng vaccination. So that's it. Thank you.
Alright, maraming salamat po Doc Chet and Doc Nina. I think that's all the questions we can accommodate for this morning. Now, alam kong may pahabol si Red, which I think it was delved on by Doc Nina already a while ago. And kay Miss Lay. Miss Lay, I think dapat na lang po natin hintayin ng official guidelines ng DOH. I think we're formulating na rin po and will come out po in the next siguro 2 to 3 weeks. So paghintay na lang po and pasensya na po, hindi po natin ma-accommodate ang mga ibang questions for this morning. So moving forward, Doc Nina and Doc Iza, I'll now call on you po for our final messages o ating reminders sa ating publiko bago po tayo magtapos. Maybe Doc Chet, would you like to go first?
Or Ma'am Nina first. Defer ako kay Ma'am Nina.
Okay.
Alright, sige po.
Doc Chet, ang message niya about the children's vaccination. Ako doon pa rin sa priority groups. Paalala lang, yung mga hindi pa bakunado, priority number 1 sila kahit isang bakuna wala pa. Yung hindi pa nakakompleto ng 2 doses, please complete your second dose. And those who are eligible, yung third dose or yung first booster na lang muna, wala pa second booster. Kasi very clear ang data doon na makakatulong yun. So we want to build that immunity wall na lahat-lahat, no? Adults, adolescents, and then children. So si Dr. Cheta mag-e-engganyo sa iyo na magpabakuna ang mga bata. Thank you.
Sige po. Thank you po, Ma'am Nina. Siguro ako yung parting words ko, una muna ay general muna, no? So vaccination is still the most important preventive measure in all age groups. So in both, si Ma'am Nina, sinestress niya, adults, hanggang children, dapat isama na natin sila. Kasi part naman sila talaga ng population and we will not be able to reach herd immunity kung hindi po natin sila isasama. So children comprise as much as 10 to 12% of those who are infected. So kailangan talaga natin silang isama. So there are many benefits, no? Direct health benefits and indirectly psychologically, mentally, socially, maraming effects yung pandemic which we hope will be mitigated by vaccinating children. And in particular siguro tong Sinovac, the data looks promising. We think with regards to safety and immunogenicity, we are still waiting for more efficacy data. But we believe that there is a role or use or indication for this particular vaccine. For instance, in those who have allergy to the other vaccines. So yun yung mga nakikita naming usefulness nung Sinovac vaccine. And we hope that it can also be part of our roster of vaccines for children. Parang mas maraming vaccines at mas maraming children ang mag-vaccinate din. So parang wala nang reason na ay allergic kasi ako sa ganyan, takot ako sa ganyan. So sana mas madaming vaccine, syempre baka mas maraming ma-vaccinate, which we hope talaga sana ma-vaccinate ang ating mga bata. Kasi nakakaawa na sila, sana makabalik na sila sa kanilang normal activities. So yun lang po. Thank you po sa pakikinig.
Thank you.
Ayan. Muli po mula sa Department of Health, Doc Nina and Doc Lisa. It's always a pleasure having you here in our program sa Kapihan po. And we hope to see you then in future Kapihan. So maraming salamat for imparting your expertise here with us and to our listeners. Now, ayun, galing na po straight from our experts, magpabakuna na po tayo at mag-comply pa rin sa minimum public health standards dahil ito po ay still the best defense against severe and critical COVID-19 or from more transmission. Kaya para sa good vibes, get vax na po. So Sir Ray, let's please roll in our video.
Oh.
Saya, isang tabi muna ang problema.
Magsama-sama, magpabakuna.
Magsayawan, pag fully vax na. Tayo'y magpabakuna. Let's spread the good vibes sa bayan. Tayo'y magsama-sama. Let's get vax for good vibes, kababayan.
And maraming salamat po sa lahat and we'll see you po next time in our next Kapihan session. Magandang hapon po and stay safe everyone.